Hello, and welcome to another episode of Boundless Body Radio. I'm your host, Casey Ruff, and today we have another amazing guest to introduce to you now. Neseret Bemient is a holistic mental health coach who assists with individuals diagnosed with mental disorders in implementing metabolic therapies, including ketogenic diets, to enhance their energy, mental clarity, and mood stability. She also provides support for individuals as they safely taper off psychiatric medications under medical supervision. She utilizes her 17 years of experience as a psych registered nurse and her personal experience of putting antidepressant-induced bipolar disorder into remission to serve her clients effectively. In her role as a mental health coach, Neseret employs comprehensive, holistic approaches to support clients struggling with mental health and addiction concerns. She works with individuals and at-risk youth and their families, helping them transition from struggling with anxiety, depression, bipolar, schizophrenia, food addiction, weight gain, lack of energy, brain fog, and feelings of numbness and suicidal thoughts to experiencing improvements, such as better mental health clarity, mood stability, weight loss, abundant energy, a sense of control, regaining self-confidence and hope, joy, self-respect, dignity, and humanity. Neseret, what I'm so honored is to welcome you to Boundless Body Radio.
Thank you so much for having me. I really appreciate it.
It's such an honor to host you. I left one major thing out of the introduction, and that is you are one of 10 winners of the 2024 Fresh Start Award given out by Metabolic Mind. Congratulations. That's so cool.
Thank you so much. Yeah, it was an absolute privilege and also something I had really never experienced in my past. Like I've had clients come to me working in the public system, thank me for, the work I've done with them, but to be actually publicly acknowledged and recognized on that level, I had never experienced that before.
That's amazing. That's so cool. I'm so grateful for
Hmm.
the Bazooki family and that organization, Metabolic Mind, for all the amazing work that they do, for all the money that they have in there. Selfishly, I have to say, I'm really happy that they gave 10 of these out, which was $10,000 to each one of you. But I got to go onto the website and see now 10 new people, well, 9 new people. One is my friend Robin, but 9 new people that I get to reach out to and hopefully host on the show. They basically took care of about a month's worth of content for me in one fell swoop. So I definitely appreciate them for that.
That's awesome. No, I think they do an incredible job with Metabolic Mind channel and their website and also other projects that they're involved in, like incredible amount of work. I think they're going to change kind of the face of psychiatry and are like pioneers in this
Yeah.
area. Yeah.
I couldn't agree more. I think it's already been very fruitful and will continue to be so. And this movement seems to be gaining so much momentum. And so, yeah, I'm really grateful for their work. Maybe they'll be grateful that I'm having all of you on, so I can actually see what you're using the $10,000 for. Like if you all of a sudden show up with like a new wardrobe, you're traveling to Monaco a little bit more frequently, like we'll know something's up. uh,
That's awesome. Yeah.
yeah, I've got my eyes on you guys. So every morning I play a few different games on my phone. I play Wordle every day. I play Connections every day, and I also play a game called Worldle. And it basically shows you an outline of a country. And I've been playing it for so many years. I'm getting like quite good at it. And today, of all days, Ethiopia was the country, and I nailed it on my second guess, which is really great. Which is where you're from. I
Yeah.
find it fascinating to think that English is not your second language. Your English is perfect. I would never guess that's kind of like a second language that you had to learn later in life. You have one of the craziest stories I've ever heard with, growing up in Ethiopia, everything that happened with your parents and intergenerational kind of trauma that you experienced. It's a crazy story. I hope you'll be willing to share some of that story today. I know it can be very difficult and it puts you in a very vulnerable spot, but your story is incredible. I'm really glad that you've decided to kind of get out a little bit more and tell that story. But can you tell us kind of your own story of what I would consider in some ways like survival, like getting out of a very difficult, kind of situation where you were born?
Sure. So um, I left Ethiopia when I was about 10 years old, 9, 10, and then I immigrated to Canada um, in 1993. So, and what necessitated that move was that Ethiopia had one of the longest, sort of bloodiest ongoing civil wars in East Africa. We were ruled by a dictator at the time, and Eritrea, which is now a separate country, used to be one with Ethiopia, and they wanted to separate. And so that was the reason why there was that ongoing war. But the year I was born, it was 1980, there was a huge famine in Ethiopia, and that was televised throughout the world. There was like fundraising. And so that was kind of like the environment that I was born in. I remember one person asking me, do you think, you would have felt that sort of like that vibration in the country, even at birth? Now we know that everything that happens, even when we're in our mother's womb, is kind of recorded within us, right? And so when I was growing up in Ethiopia, I heard a lot about the war. My mom used to be afraid that, the government would come in and just take one of her kids, my older brother. They would come in and just forcibly take like 13, 14-year-olds to go to war. And so she was always worried about the boys being taken away. There was 3 boys, 3 girls, and then the girls potentially something happening to us, being raped or whatever the case may be. So that's kind of the environment that I grew up in. And in 1991, during the first Gulf War, Ethiopia had just ended that ongoing civil war. The Eritreans separated. The president fled the country. They took over the country, basically, the Eritreans. And so we witnessed all kinds of horrific things, like dead bodies on the side of the road, mass graves being dug. And my mom basically at that point decided that it was time for us to leave the country. So we fled the country. And that's a long story. It was a harrowing journey to go from Ethiopia to a neighboring country, Kenya. And we ended up 35 kilometers outside of Nairobi in a refugee camp called Thika. And we were there for 2 years. It was a tent city. People didn't have much. I remember being a kid and lining up for food for hours. Just a kid, like once a day. It was very embarrassing. Fights would break out and over food. And I mean, it was minor stuff it was very little that we got. So out of all that, we were lucky ones that found sponsors to come to Canada. So we immigrated when I was 13 years old. So it was, and I probably knew the alphabet when I first came here. Like I knew English wasn't a second language. Like in Ethiopia, there's about 80 different languages that are spoken. And the official language is called Amharic. So I knew the alphabet, but I had to learn English. It wasn't optional for me. And so sometimes when you're a kid and you're in that situation, you pick it up very quickly. But I've always also been interested in reading and writing and history and all those things. So I gravitated towards that.
Mm.
Yeah,
Wow,
so
that's crazy. That's a
yeah.
crazy story. Wow. Okay. So you made it to Canada. I assume everything was much better in that situation. And you decided to pursue nursing. What was that kind of career decision like? And why did you want to get into that?
So that's interesting because it was a huge transition adjusting to the culture, the language, and everything else. And my mom had always had this dream of having one of us become a nurse, and I was interested in it as well. But when I decided to go into nursing, I was 18 years old. And most people ask me, like, why did you become a psych nurse? And I don't ever remember thinking I wanted to be a psych nurse. I didn't even know what a psych nurse was, or psychiatry, or a mental hospital. That was not even in my point of reference. So when I went to nursing school, I thought everything was interesting, but I almost thought I had made a mistake until the last year of the last semester when I had my mental health class. And I really just wanted at that point to understand myself. So it was more like there was years of unaddressed, like significant history of trauma, not just, in Ethiopia, but in a refugee camp, or even coming to a new country and adjusting to all of it. And I think one thing I also mentioned is that when I was 16 years old, I left home. I didn't know anybody in the country, but there was domestic violence happening in our home. And I just decided, and I spent my last few years of high school in a group home, and I graduated with honors, a full scholarship. But I was a kid who was just containing everything. And my self-esteem was non-existent at that point. Everybody thought, I was the teacher's pet, good kid, had everything going for her. But inside, I was trying to make sense of everything that has happened up to that point. And when I went into that mental health class, I thought, I want to understand myself. Like what's going on within me right now? I don't know. And so that was actually what led me into psychiatry.
Wow, interesting. So what did you assume the medical system would be like when you first started? I know it's kind of hard to like go back and try to remember what you thought you would be doing, but you come from Ethiopia, and like what did you think the North American kind of medical system would be like and how you'd be able to help people?
Oh, sure. I mean, I come from a country where women die giving childbirth because there's no medical access. Okay. So that is and that's where I come from. And so I thought this is the state of the art medical and psychiatric system. And so this must be sort of like the best of the best and evidence-based. And that was what we were taught in nursing school. I would be helping people. It's an honorable profession. Um, medication was right away. I noticed that medication was a central piece of sort of the work. And I thought, well, this must be the right way, even though, you know, I come from a line of people who believed, in herbs, and natural things and whatnot. I thought, well, that must be not the way to go because, you know, and and so right away I thought this is interesting. Like, but when you're 18 years old, like right at high school, you're kind of naive, and then also not understanding what was going on. Like, I'll give you one example. I never saw a dentist until my early 20s, like 24. I never had
Oh,
any problems at all. And I remember the first time I had a cavity because when we moved here, um, we started eating the Canadian diet because that was a novel and we wanted what people, our friends ate and whatnot. Prior to coming here, we never really had any sweets or treats or chocolate and all that stuff. That was not in our diet. So our teeth, we had never had any problems with our teeth. So I realized looking back now, this was the dentistry industry was an industry really based on this diet that destroys people's health. Now I know, but also that's why people have issues with their teeth.
wow.
Never had a cleaning. Like, I mean, I brushed my teeth, but that was it. It's just my diet wasn't, um, when coming from Ethiopia, it wasn't filled with a lot of sugar at that point. But then once we kind of moved to Canada and started eating the same diet, then that's when problems started.
Wow, fascinating. I
Mhm.
guess I did want to ask you, I probably should have asked you a little bit earlier, but when you got to Canada, there must have been so much more like food abundance. Did it ever create any kind of eating issues with yourself or any of your family to go from a place where maybe food was a little bit more scarce to a place where food is abundant?
It was more, I remember being like standing in a grocery store and thinking, like feeling really overwhelmed. I had never seen that amount of food in the same place. And I would say none of us had a really disordered eating, but we gravitated towards sort of like a more unhealthy diet just because we thought it was tasty. It was different than, my mom still made Ethiopian food and like tried to make healthy food at home, but we wanted the Canadian food,
Gotcha.
right?
Yeah, I would think
So
so.
no, I don't think any of us had any disordered eating per se, but we had our taste definitely changed once we moved here.
Yeah, gotcha. Okay. Now, when you started practicing as a psych nurse, I don't know that we've ever had a psych nurse on this show, so I don't even know what your practice would look like. How would you help people? What was kind of like your day to day? Yeah, what were you doing when you were practicing?
Sure. So my first job as a new grad was in an acute care unit. Essentially, it was a 25-bed unit it was a catch-all. We had people with anxiety, depression, bipolar, schizophrenia. We have patients with eating disorders. Some of them were directly admitted from Emerge, and then other ones came from the community, but they came at the height of their illness. One of my main roles in that position was to administer and monitor medications. We're essentially the ears and eyes of psychiatrists. We go between the psychiatrist and the team and the patient. We spend 24/7 with the patient. Like, I worked 2 12-hour days, 2 12-hour nights, and then 4 days off. That was what I did for 4 years straight.
Wow.
After that, I went into the community as a mental health and addictions case manager. I worked in a methadone clinic. I worked with the homeless population. But essentially, as a psych nurse, you have like, it's frontline work, direct care. And one of the main roles was medication management, either in acute care and in any area most of the time. I also did, the 10 years was with the adult population, and the other 7 years was in the pediatric population. I worked in children's emergency for 5 years and an adolescent treatment center for 2 years as well. So, but in all of those, we did many things. Of course, we did, counseling, coaching, support, educating, raising awareness, and all of those things. But one of the big areas that we worked in also is administering and monitoring and managing medications.
My goodness. I'm just hearing you describe that. I'm wondering, as you reflect back on most of your coworkers, were they all also younger people, like just starting their career? That sounds like the turnover rate to do something like that would be incredibly high. That sounds very high stress and like a lot of hours working.
It's incredibly stressful. My starting class, the first year, was about 120 students. And half of them were probably from right out of high school, but half were people who were coming in for a second time career. The oldest was 57 years old, but the graduating class 4 years later was about 25 people. So the burnout and the stress starts right from nursing school. Now there is, in the States, for example, there's going to be about 1 million nurses that are going to leave the profession. And that can happen anywhere from the time, 2 years in to 5, 10, 20 years. But specifically with psych nursing, I would say it is one of the most stressful line of work you can be in, because every day you're having to witness people's incredible suffering. You have your own trauma, and each of us have our own trauma, our own challenges and limitations. But I was seeing, I would say, in the 17 years I worked, about 30,000 hours, 4 to 6 people every day, usually at the height of their whatever crisis they're in. And they come in, and it's just like psych nurses, or people know, even when I am in public or anywhere, they can come and just tell me their entire life. So they will tell you everything, the most intimate details of their lives. So I've had personally multiple burnouts, and I think the nursing profession, we are expected to operate under circumstances that you would never expect a physician, like a surgeon, to operate under. You would never expect them without support or self-care or proper resources, but nurses are expected to work under those circumstances. So many people leave the profession, for sure. It's incredibly stressful.
I think I've heard you say on another show that you are an introvert as well. I am definitely one. And as much as I love low carbohydrate conferences at the end of a 6-8 hour day with all the people in a conference room, I've been known to kind of sneak out the back door and not say goodbye to anybody. Hearing you as an introvert have to take that on, and not only dealing with your own traumas, but everybody else's traumas. Oh my goodness, you must have, yeah, heading home must have been like, I need a nap before I can talk to anybody.
Yeah, that's exactly how it was for me most of my career. And I always considered the people that I had the privilege serving, they were like my family. And that is all the socialization for the most part I needed. There's my partner, my daughter, a couple of select friends, but I pretty much was spent by the time, I get home. And like I said, these are the stories that you hear, you're kind of like, wow, your story is really crazy. And I do agree with you. My story is pretty complicated, and there's lots of kind of things that maybe a lot of people don't necessarily experience. But I think each of our stories are very unique as human beings. But the stories that I heard as a psych nurse, I felt the same way about them. I was always amazed. How is this person sitting in front of me right now after going through everything that they've gone through? Like, how is that possible? So in a way, I always felt like the people that we saw were incredibly sensitive. They have experienced not just a little bit, but significant history of trauma. And so from that point of view, I felt like I could connect with them and I could have just an immense amount of compassion for them because I had gone through the depth of suffering myself in my own life. But in some ways, I look back now and I think I was limited in what I can really offer them to help support them in their way. And that became very clear to me when I entered the mental health system as a patient myself, and then went through that journey along with my clients. And I realized how brutal that process, that system was to go through.
Yeah. Wow. It's such a good point that you bring up about trauma. I think oftentimes we try to compare trauma. Like I didn't grow up in Ethiopia. I was never, around food, being unavailable. You know what I mean? And so I can't say that like, oh, my parents left me in my room to cry is so much less severe. Well, to me, it could be exactly the same. All of us have those traumas, and you can't just say that, oh, this person was brought up in a war zone, so their trauma was so much worse than somebody that was brought up in, the United States or Canada. It is extremely subjective.
Yes, absolutely. And some people are able to get through some traumatic experiences okay. Other people, their temperament and just who they are and how their constitution, something less even dramatic can be just as impactful for them. So it's just we're all affected differently by it. So I never like to compare things, but we're all unique in that way for sure.
Yeah,
Mm-hmm.
interesting. Well, we've hosted Lauren Kennedy West recently. She has the channel Living, I think it's Living Well with Schizophrenia. And she may have rebranded, but anyway, she had a similar experience of getting trained in therapy and counseling and that sort of thing, and then having her own kind of event where she was put on the other side of the system and got to go through it as a patient. So you guys had that kind of commonality. What was that like? How did that all kind of come about?
Yeah, sure. And I think her rebranding is living well after
Thank you.
schizophrenia now after implementing the metabolic therapies
Thank you.
and keto. Beautiful story there. An amazing individual. For me, so when I was 30 years old, I had undiagnosed and untreated low thyroid symptoms, which mimic psychiatric symptoms. At that point, I had also worked in that locked acute care ward for 4 years, and I was going into burnout. On top of that, I would say I had significant history of trauma that was never addressed. I had never gone through therapy or anything for what had happened in my childhood. So there was those three core things that were happening at the same time. So I went to see the family physician and they did the blood test and they found my thyroid was low. And the proper protocol would have been to treat the thyroid disorder to see if that would resolve. But they suggested I started on antidepressants at the same time. So I was started on a low thyroid medication as well as an antidepressant on the same day. And within about 2 weeks, I became hypomanic. And that was the first time I've had a hypomanic episode. The thing that is disturbing to me in that process and that I have seen happen to kids and adults alike is when somebody comes to you and you talk to them for 10 or 15 minutes, or it might have been a patient that you've known for a while, but the real core issues, the underlying issues in this person, for me at the time was burnout and also disillusionment in my career because I saw so many people come in, get on high doses of cocktails of medications, not do well, have adverse reactions. Many of the times, those medications had to be immediately stopped. Litany of trials of drugs. And it became this meat grinder that I was working in. And very quickly, I knew from day one, there was many questionable practices in psychiatry. There was all the childhood stuff that was not addressed. And then I had a medical condition that caused problems for me. Other people might have nutritional deficiency. Other people might have a brain tumor for that matter. You really don't know. And so in psychiatry, when somebody comes to you, there's this mad rush to diagnose and medicate someone. And that was what happened to me. When I suspected, like just like most healthcare professionals who tend to self-diagnose, while I was going through my education and working in psychiatry, I suspected I had something going on, I suspected it was PTSD or anxiety, which was accurate. I think it was, and based on my experiences in the context of where I came from, that was totally understandable in terms of like, I actually saw a psychologist recently. Once I did the metabolic therapies and keto, I was able to address trauma. And the diagnosis they gave me was CPTSD. Not that I have an attachment to that diagnosis, but that felt more accurate to me. But at that point, when I was 30 years old, that was the first thing was just, oh, here's some medication. And so that's how I entered into the mental health system.
Gotcha. How
Yeah.
did the medications affect you? I know you mentioned that you had that hypomanic event. What is that like?
Hypomania is a very seductive state, I would say. It was a sense of euphoria. I became outgoing. That was just a personality change. I had lots of energy, lots of creativity. At the same time, I was irritable, agitated at times. My judgment was impaired for sure. There was hypersexuality. There was lack of some focus in some areas and other lack of focus, more spending. And it was, it's kind of, now I look back at it, and Peter Breggin, he's one of the pioneers in the in a critical psychiatry movement, and he talks about medication spellbinding. So it's a person who is under the influence, just like somebody who is on cocaine, on alcohol, or anything. Psychiatric drugs fall under, psychoactive drugs. So I was under that spell during that time, and it was. I remember thinking, even though, I was a psych nurse and I had witnessed all of these things, when it happens to you, I thought I must have been absolutely deprived all my life because I did not know that you can feel this good. And it wasn't really good, but it felt like just like Gabor Mate. I don't know if you're familiar with him. He's written, In the Realm of a Hungry Ghost. He does a lot of work with addiction. And he says that when his clients describe to him the first time they ever had cocaine or the first time they ever had meth or whatever it is their drug of choice is, they describe that feeling as being embraced by a mother, or being just held. And in a way, that is how it felt to me when I first was on psychiatric drugs. It was this high that I did not even know was possible to feel that way. So it was definitely an alteration of something in my brain, in my body, that was very drastic. And over the next 13 years, I was trialed on 10 different psychiatric drugs. 8 of them I had to immediately stop within 3 days to 2 weeks. Because I had severe adverse reaction. One of them was lethal, which was a medication called Lamictal. I had developed what's called Stevens-Johnson syndrome. You can actually die from that, and it was on the lowest dose, 12.5 milligram. And the 2 that I stayed on the longest, I would say, wreaked a havoc in my life. I had weight gain, brain fog, cognitive decline. I had no energy. I the most disturbing thing was suicidal ideation. I had never considered suicide before I got on psych medications. It just was never on my radar. For a 30-year-old who had gone through everything that I went through, I was in a loving relationship. I had my daughter, I had a career, I had graduated from university, like all of these things that I accomplished. And then at that point, I actually started my YouTube channel back then too. A year later, after I became a nurse, and I thought I wanted to raise awareness about mental health. And for a decade, I did absolutely nothing with it. I wanted to write, I wanted to do all the things that I was doing now back, 14 years ago, 13, 14 years ago. And once I got on psych meds, I kept working as a psych nurse, but it was just barely keeping my head above water.
Wow. Wow.
Mm-hmm.
You hear that story so many times with people, especially with bipolar, like trying to get on a medication, adjust a medication, get off, try combinations of medications, all the side effects you hear about. In your experience through your career, being 2024 now, do you feel like we've made any great strides as far as medication for mental health, or is it pretty much about as dire as it was when you first started?
So this is how I look at it. Psychiatry has a very checkered past. So way back, they used to use waterboarding physical lobotomies, brain lobotomies. What has happened in the last 40 to 60 years is we use drugs as the first line of defense. And if you look at the sales for antidepressants and psychiatric medications globally, or even just in the US alone, the top 10 drugs in the US, psychiatric drugs, gross about $88 billion.
Wow.
So what has happened, and for most people, they're told that mental illness, the dominant narrative is around chemical imbalance, which the pharmaceutical industry has done a fantastic job of selling to the public that there is something wrong with your brain. There's a chemical imbalance, even though it is a lie and a theory, it's all it is. They've done an amazing job so that people trust doctors and psychiatrists and go in and are told they have to be on these medications for life, and that these medications, drugs, are safe and well tolerated by most people, which is not true. At least from my experience of witnessing day in and day out for 17 years, that's not the case. In fact, they're not well tolerated by most people. They're toxic to their system. So, have we made, excuse me, have we made progress? Well, I know this is strong language, but what I consider treatment with drugs, especially long term, and I'm not, I think for psychiatric medications in acute crisis or short term stabilization, there's a place for them. But that should be last resort, and along with everything else that can be implemented. What people described to me and what I experienced in my own life was what I would call a chemical lobotomy. You're cut off from your emotions. You're not able to address your trauma. You can barely survive. And then there is the effects that people experience, some of them which are irreversible and permanent, are disturbing, like your sexual dysfunction, involuntary bodily movements. There's all kinds of things, the cognitive decline that people experience. It's essentially strips you off of your humanity, not to mention the metabolic dysfunctions that it causes. For example, for treatment for schizophrenia, you're talking about Lauren, people die 20 to 30 years younger because of those treatments. So to me, that's not progress. We're human beings. Why would you take that humanity out of someone and their dignity? And to me, that's what I witnessed over the years, that over time, especially when I went into the pediatric system, and I realized this is what we do to 13, 14-year-olds. We put them, they come in and they say, I've been bullied online, which means 24/7, by the way. And there's actually, I was reading on X today that there's an inquiry in New Zealand of 6 kids that died between the age of 13 and 16 who were all put on SSRIs. And one of them was a 14-year-old girl who was bullied all year in 2017, She was put on an SSRI, fluoxetine, and the doctor increased it to 10 and then to 20 and then doubled it to 40 and told her he would see her, 4 to 6 weeks, and she committed suicide during that time. The second leading cause of death for youth, besides motor vehicle accidents today, is suicide for 14 to 24-year-olds. Why are our kids thinking that their lives are not worth living? Is this forward movement for us as a society?
Strong statement. Wow. Strong statement. I don't think there was any risk of a pharmaceutical sponsoring our podcast, but now for sure they're not after them hearing that. So, yeah, that's really strong, and that's really disturbing about the suicide rates as well. Fortunately, we know, and you know now, that there's other ways to treat this, and we're probably doing this in the wrong order. Like, we can start with some really simple, basic things, and then, like you said, use medications when needed temporarily for certain situations. And so eventually you found metabolic therapies for mental health. How did you discover information about that?
So I actually started implementing metabolic therapies in 2016. I really didn't know what that was, but essentially I started with getting rid of birth control, which that is another topic and information that they cause all kinds of problems for a lot of people, a lot of women. And then I started walking 5 to 10K a day. I instituted intermittent fasting. I gave up shift work and started just having reset my circadian rhythm, lots of light exposure during the day. And then a couple of years ago, I came across the work of Dr. Chris Palmer, Metabolic Mind, Bipolar Cast with Dr. Ian Campbell, and Matt Bazuki. And I realized inadvertently, just from like desperate place of searching, I started doing things where it was making a difference for me. And the last thing I implemented about a year and a half ago, initially I did carnivore for about 3 months, which allowed me to rule out a lot of food sensitivities, which I had to gluten and dairy and sugar. And then, but I couldn't keep up carnivore, even though I loved the carnivore diet, because I kept having a reactive hypoglycemia. So I added a little bit of carbs, and that's when like my blood sugar stabilized. And then I was able to taper off lithium and an antidepressant called mirtazapine that I had been on. I was on lithium for about 6 years at that point, and mirtazapine I had been on for like 13 years. And I was able to taper safely off of that. And I would say keto was that kind of catalyst. And another thing I would say is that I was with my partner of 9 years now, and he has seen me through like the worst parts of it, and he also had like incredible support from me. And that was something, when we think of metabolic therapies, we're kind of focusing on the things that are more physiological. But for me, having my partner who was incredibly supportive and accepting and just really adored me and supported me through this process was invaluable as well. And I also had my daughter, that I really wanted to be able to overcome this so that I could be there for her. And even though she's going to be turning 22 soon, like our kids need us throughout their lives, and so I had a lot of motivation. I also wanted to, from a career point of view, I was so disillusioned at that point because I realized for those years when I was the patient in the system, and working alongside my clients, I felt so powerless because I witnessed the hopelessness and powerlessness my client felt, but I was in the same boat. There was no difference between us in that sense, or in any sense for that matter. We're all human beings. We all want to thrive and experience peace, joy, and happiness, and we all don't want to suffer. And so I realized that the only thing that we had to offer in psychiatry, the only toolbox, tool in the toolbox was drugs, more drugs, different kinds of drugs, different doses of drugs, but the conversation always centered around drugs. And also giving the person this message that they have something wrong with their brain that cannot be fixed. It's broken. And you have to stay on these medications that are going to give you terrible side effects, because what's your other choice, right? So to me, I came to the conclusion just a little over a year ago, I did not want to have anything to do with psychiatry in that sense of working in the system. There was a lot of ethical, moral dilemma over the years. And I realized, I came into psychiatry with a clean slate. I didn't have any preconceived ideas of what it is supposed to be or not supposed to be. And what I witnessed over those 17 years nearly destroyed me, not just because of my own journey that I went through, but witnessing that amount of suffering and devastation in people in a developed, civilized country. It's just bizarre. It's strange to think about that this happens to people in the state of the art healthcare system.
Wow, it must have been incredibly difficult for you to come to that conclusion and decide to, switch what you were doing and how you were working with people. So I have a lot of respect for that. And at some point, you heard about Metabolic Mind and the Bazooki Group. When did you hear about the Fresh Start kind of program and the grants that they were giving? And when did you decide that you wanted to put your name in the hat to receive one of those?
Sure. I first started networking on X with different people. I spent a lot of time on the Metabolic Mind channel. I reached out to a few people in that community. And I also took Dr. Georgia Eads' course for clinicians for the ketogenic diet, like for mental health therapy. And so I actually started, like I said, when you're someone who's questioning psychiatry from the inside, you're on your own, like you're alone. And so for me, I naturally wanted to connect with other people who validated the feelings that I had about like the profession and how things are done. And so I was starting to search for that kind of sense of belonging as well. And you know, all of these people in this community were just doing amazing work. And I felt a sense of kind of kinship there. And so I did start connecting with different people. And a couple of people actually sent me an email saying, hey, a couple of my clients and a few connections that I had saying, hey, you should apply for this. And I was just like, what is this? And I looked into it and I was just like, you know what? I meet all of the criterias when I looked at sort of what they were looking for. And I thought, why not? I'm going to apply for that. Yeah.
That's
So
amazing.
yeah.
That's amazing. What was part of the process? Didn't you have to write like an essay and also get some recommendations as well?
Yeah, it was an essay and then a little video just saying like why what I'm doing, sort of your goals for what you want to do with the funds, and some of the things like podcasts that I've done with different people, and there was a couple of letters of recommendation they asked for. So there was a few different things, and but it didn't take very long to get all that together. It was fine. Um, yeah. So, like I said, it was incredible for me because dedicating my entire life for 17 years in that system, nobody ever set me aside and say, hey, I think I was supposed to get a pin from one of my employers. Never got the pin. And here I am. I'm just like, just the past year, working in my own recovery and supporting others in theirs. And somebody actually noticed and said, hey, we appreciate what you're doing. It's just like, wow.
That's incredible.
Yeah.
Before we started our own company, we were working for a big kind of corporate gym. And on my 10-year anniversary of working for the company, they sent me a folder with a piece of paper in it that said, thanks for working for us for 10 years. Like, really? That's what you give me? It's terrible. That's amazing. So how did you hear the information that you had won?
Oh, I got an email from the Metabolic Mind team. Yeah.
What did you do when you saw the email?
Well, I just thought, oh my gosh, this is awesome. I thought I told my partner, and I was just like, hey, look at this. Um, yeah, I
That's
was pretty
amazing.
excited actually.
So according to Metabolic Mind, what is the $10,000 kind of for? I'll ask you what your individual vision is, but when they gave you the $10,000, what did they say that they expected from the recipients of the award?
I think it's to use the funds to further your education as well as the projects that you're working on, what you're doing to spread the word around, metabolic therapies and the keto diet and how that's making a difference, which I would say all of the 10 people that won those awards, we are already doing all those things. Personally, the project that I'm working on is a book um, about my own journey and also a guide for psychiatric survivors of, how to find your path to healing if you're coming from the traditional system and you want to find an alternative. So that is what I'm working on currently, and my partner and I are also designing a digital online education for people who also want to implement and taper safely. So those are the two areas that I'm planning to use the funds to move forward and to further this work.
Yeah, that's amazing. I'm so glad you said that about all of us kind of doing this work already anyway. It's kind of funny to compliment to contemplate, but I don't think the $10,000 given to you 10 recipients, I'll bet you squeeze every last penny. It is so effective with the money that you get because again, we're also passionate about this anyway. We're already doing the
Mhm.
work, like you're already doing it and getting the message out. I'm sure that $10,000 in your hands and the hands of all the other recipients will go very, very far.
Absolutely. I think, and more than anything, I think the acknowledgement or the work that you're doing is fantastic as well. But definitely, I think it's an amount of money that you can put into a project and get off the ground. Yeah.
Did you know any of the other recipients?
I was familiar with the few in on from X. So
Okay,
yeah.
nice, nice. And do they do any type of like presentation? Do you guys meet up together, or is it just pretty much you get your award and then you're allowed to kind of use the money however you see fit?
That's correct. And we had a meeting with Metabolic Mind. There was a ceremony that they put together. It was online, like but yeah, that was really nice as well.
Wow.
Um, mhm.
Yeah, well, congratulations. I think that's amazing, and I know you will, again, take that money very, very far, which is great. Part of all of this has been your journey to want to share your story a little bit more. Writing a book about all of that would certainly be a huge challenge. What has it been like to kind of go through that bit of transition of like uh, wanting to talk about your own like personal journey and your work with people as well?
Yeah, it's been interesting. It's therapeutic in some ways. In other ways, it's excruciatingly vulnerable because the topics that I talk about in my story are about trauma, about domestic violence, about mental illness. But also there's a lot of hope in it. I've had a lot of people reach out to me on social media as well as like through email from different places saying that my story gave them hope and that they can relate to it in some ways and that there is a solution that's sustainable. Um, so it's been, and then to have this renewed sense of understanding of my journey. And I'm kind of, that story is still evolving for me because I realize now you can always, Steve Jobs says you can connect the dots when you look back. But when you're in it, in the thick of it, you don't know what's actually really going on. So I'm still kind of making sense of everything that has happened and where I stand in these issues. And yes, sometimes I do use strong language, but I find that in psychiatry, there's a lot of soft language. People kind of, walk on eggshells and kind of don't want to say the wrong thing, but I don't want to do that anymore. I want to just say it as it is, how horrific these things can be for people. And one area, for example, is tapering off of drugs. People are told these are safe, well tolerated, you won't be addicted to them. But the truth is they develop physical dependency. And it's horrific to come off of them for some people. So I don't want to and some of what I say might not be popular, but the truth is this is what happens to people. We're talking about lives, our kids' lives, and our human beings' lives being devastated by something that could have been solved, like you said earlier, with simple, powerful interventions. And so to me, I just feel like it's my job to share what I have witnessed and what I have experienced, in the hope that it prevents, nobody has to go through what I went through. And if there's a way for us to prevent suffering, that is the right thing to do. That's the absolute right thing to do. And if there's a way for us to address issues in a less evasive, less risky way, that child who was dealing with bullying, or that child who was going through a tumultuous rite of passage of questioning identity, a spiritual crisis, well, that should not be medicated. Or even the child that I was, that went through and witnessed terrible things, that should have been addressed differently. There should have been some cultural sensitivity and sensitivity to the background of where I came from and what I went through, and understanding of a person, where they are in the context of where they came from. There are many things. I always say there's 1,000 paths to healing, and there's different ways to look at a human being and approach them in that way, like with respect and dignity and care. A drug should be the last resort, not the first line of defense, especially when it comes to kids with developing brains.
So well said. I really wanted to make sure we reiterated something that you just mentioned, which is the deprescribing part of these prescriptions. Why is it absolutely critical to be working with a medical professional as you're trying to ramp some of these things down and not try to do this yourself?
Yeah, that's an excellent question. So many of the times when people start reducing or stopping, which is the elephant in the room in psychiatry, is there's a huge non-compliance issue. People don't want to stay on these drugs, but they are not told how to properly come off of them and safely taper. Most people are told you can taper in 2 to 4 weeks, which is extremely fast. And what happens is they will incur injury during that process. But during that withdrawal process, they go back to their clinician most of the time, and they're told it's the relapse of their illness, or excuse me, or an onset of a new illness, which is both can be a misdiagnosis. So having proper support with deprescribing and safe tapering is critical, but it's non-existent in psychiatry. Mark Horowitz and David Taylor wrote a book called The Deprescribing Guideline. Fantastic book, just an amazing work. Another person who does incredible work with tapering I've worked with for a few months is Dr. Joseph Wood-During with the Taper Clinic. Oh, excuse me. So they really go through the protocol, both of them, of how to come off of these drugs. But in the mainstream psychiatry, it's not recognized at all. And even throughout my career, when I was going through it, most people are told, oh, here we go, this is a proof of your illness. And I went through the process myself. Many people feel stuck in the drugs that they're on. The prescribing guideline for antidepressants, for example, for mild depression is about 6 to 9 months. And for moderate to severe depression is 1 to 2 years. But on average in the US, people stay on antidepressants for 5 years or more. So it's a huge problem. And I tried to come off of mirtazapine several times. And what I would go too fast. And so I would end up with anxiety, panic attacks, severe insomnia, as in I couldn't sleep at all. So I would be afraid that I would end up in emergency and also hospitalized. So I would reinstate, I would go back on it. And that's what people go through. And like I said, that narrative of this mental illness being chronic and lifelong, that's reinforced through that. When I finally implemented keto and metabolic therapies, I went very slowly to taper. I also worked with a compound pharmacy, which can make tiny doses of the medication for you. Some people will go into liquid taper, which allows you to really go what's called micro tapering. So you just take out a tiny dose every single day. There's many different ways to do this, but it has to be medically supervised, and you have to have some support to do this. You don't want to taper too fast. Sometimes it might take you 6 months to a year. Some people might be 1 to 2 years, depending on what medication you're tapering off.
Okay. Thank you. I
Yeah.
really I appreciate that. One of the things I really love about your work is that you mention nutrition, but you also mentioned that nutrition is not the only thing. There's other things that can help. In your mind, is anything weighted more powerfully than nutrition when you look at all the tools that you have available to you? Or do you find that, yes, there's lots of other things that we can do. However, nutrition is like the big one that makes the most gain for most people. Obviously, this is highly individual and not necessarily able to like generalize for everybody. But if you take a 30,000-foot view, how do you think of nutrition as part of several tools in a toolbox that can help somebody?
I would say there's the fundamentals for everyone: sleep, diet, exercise. Those are like the big major ones. But what I found personally is that there was a cumulative effect of stress reduction, mindfulness, exploring spirituality, exploring healthy connections, meaningful work. There's so many different things, but I would say the biggest one, because food, diet, like Dr. Georgia Ede says, it's the precursor to our body, our physical body. Like literally, this is the food we gather over time. And our brain chemicals and bodily hormones are made up of the food and drink that we use. So yeah, I would say the diet is a fundamental, the same as sleep and exercise. Movement is the way we move energy, and the same as breath work is another thing. So there is so many paths that can be explored, but I would agree with you in that, like, diet is one of the biggest ones. I would say it's the most powerful, at least, intervention I've come across in my experience.
Yeah.
But there are many other things people can explore that also add, like you just kind of layer one thing over another, and it all comes together and kind of creates this healthy space for you and your body. It's a soothing and nurturing. It's the act of self-care. But what might be working for me might be a little bit different. I love reading. I love studying. That's another thing, like educating yourself. It might be journaling. It might be, I don't, acupuncture for someone. It could be massage for another person. I don't know, but there's many things that you can stack together that are going to be giving you the effect. But food can be medicine, and it is something that we have to intake every single day, 3 or 4, however many times that we do. So that is, I would say, one of the most powerful things that you can use.
Excellent. Yeah, that's very, very well said. I think in my experience of coaching people, I found that, yeah, I don't necessarily have more importance on one of those things versus the other. That said, if somebody can get the nutrition lever pulled, it's more easy for them to then get the exercise lever pulled because their energy is higher. And I'm willing to bet that also their sleep is just going to naturally kind of improve and get better. And you mentioned mindfulness. I've done mindfulness practices in my life at different times in my life, and they always go better if I'm eating a very low carbohydrate or carnivore diet than the times I reflect back when I had a mixed diet. It's just like, it feels like if you get that one, you get all the other wins, and they all accumulate to really help with all that stuff. So, oh, this has just been an amazing conversation. I am so grateful for you that you have done such amazing work in your life and decided to speak up about it and share and apply for that grant, because thinking that Neseret, I might not have even known about you and your work if it wasn't for that, and winning that award would be a huge bummer. And it's been such an honor to have you on the show today and chat with us. Your smile is infectious. Your story is incredible. And the way that you're working with people all over is just absolutely amazing. So you very well deserved as far as winning that award. Tell us where people can go to find you and connect with you and your work.
Thank you so much. Thank you for your kind words. I really appreciate it. And I look forward to listening to the other interviews that you're going to do with everyone as well.
It's going to be fun.
Yeah, I think that's going to be really fun. Yeah, I have a website, mentalhealthreset.org. That is one place. And then I have a YouTube channel and an X profile as well. Those are kind of the main areas that I use for sharing what I do.
Perfect. Yeah, we'll be sure to link all of that up in the show notes. You were very responsive when I reached out to you to see if we could host you on the show. You got right back to me. So I know that you are very much willing to help people out there. And yeah, like I said, this has been such a fun conversation. Maybe we can do a follow-up in a year or two to see what the effect of the grant was and how that went. But for now, Neseret, thank you so very much for everything again that you've gone through and being willing to talk about and be vulnerable with it and actually get the message out to more people. It's going to help a lot of people. And I think the strong statements that you said they needed to be heard. And so again, we just really appreciate you and thank you so very much for taking time to be on our show today. We really appreciate you.
Thank you. Thanks, Casey.
Absolutely. And this has been another episode of Boundless Body Radio.